Hey guys! My name is Dr. Charlie Tooth.
And I'm Dr. Smashmouth.
And we're going to talk about the life of a pediatric dentist.
So first of all, what do we do?
Pediatric dentists work with kids from when they're itty-bitty babies to rambunctious teens.
They work with primary and secondary teeth coming in and teeth that are falling out.
They help kids develop good hygiene habits by teaching them proper brushing and flossing techniques.
They also need to be able to have patience and precision with squeamish children and their small mouths.
And since children's teeth are hard to clean and prone to decay, pediatric dentists provide basic cleaning services and fluoride treatments.
If they think that a child's teeth aren't straight, they may refer to them to an orthodontist.
If you want to become a pediatric dentist, here's a few things that you should know about the process.
Pediatric dentists have to study and be very familiar with diagnosing and performing surgical procedures.
They have to go get their national licensing, along with their pediatric dentist license, for permission to practice pediatric dentistry in their specific state.
Pediatric dentists are also recommended to take the board exam, but it is not mandatory.
There are a few procedures that are specific for pediatric dentists, but first, let's talk tools.
Now, pediatric dentists use a lot of the same tools and procedures as general dentists do, but the tools are way smaller and the procedures are modified for young children.
There's also a bunch of special procedures that we pediatric dentists use on kids. For example, cavities or caries is a progressive disease in the form of tooth decay. Some of the bacteria that live in your mouth feed off of the sugars in the food you eat. These bacteria then produce acid that can damage your enamel, creating weak points which become cavities. Cavities can be very painful and lead to nerve damage and teeth extraction. Thankfully, there are a few ways to prevent this.
Fluoride treatments are one of the main ways that pediatric dentists prevent cavities at the dental office. Sometimes the mineral of the tooth's enamel weakens and fluoride can help stimulate remineralization where the enamel is a bit weaker.
Most, if not all, pediatric dentist offices do sealants, which are a layer of thin protective plastic or dental material that covers the teeth and protects against cavities. These are best to do as a kid or young teen because that's the time when cavities can form very easily.
Daily brushing and flossing will help to reduce your chances of tooth decay. But there is a dental material that can be placed on the chewing surface of your tooth to help seal out plaque and acids before they form a cavity. The material is known as a dental sealant, and it is a layer of thin plastic which is painted onto the outside of the tooth. The sealant acts as a barrier to prevent cavities from forming. The procedure is painless and takes just a few minutes in your dentist's office. For the most common type of sealant, your dentist will clean and dry the tooth. Then they place a gel on your tooth's chewing surface. The gel prepares the surface of the tooth for the sealant. Once the gel has been rinsed off and the tooth has been dried, your dentist will place a liquid plastic material in the grooves of your tooth. A special blue light will harden the plastic. The plastic forms a sealant. Anyone can get a sealant, including adults, but children and teenagers are often the best candidates since the earlier you can place this protective barrier on the surface of your tooth, the less likely you are to develop a cavity.
Stainless steel crowns are used when there is too much damage for the teeth to hold the white fillings. These teeth are usually back teeth with extensive damage to the enamel, dentin, and sometimes nerve. These silver cover crowns are fitted and cemented onto the baby teeth so that there is no further damage.
Sometimes teeth fracture or they decay slightly. In these cases, tooth-colored fillings are used. These fillings are made up of a resin that can be used in the front or back teeth and where cosmetic appearance is important. We can even make the color match your teeth so it's as seamless as possible.
Some offices also provide oral sedation services, where the patient is given an oral medicine which can help reduce young children's anxiety about the visit or increase their cooperation during the procedure. It's also used for very long procedures to help the child accept the treatment, help prevent injury, and for those with special needs.
The papoose board is a medical stabilization board which restricts the patient's movement by wrapping around the patient and securing their limbs in place. This leads to a smaller chance of injury during the procedure.
For younger children, the lap-to-lap technique helps reduce anxiety. The child will lay partially in the dentist's lap, looking forward at the parent, and partially in the parent's lap.
Because you're one, you get to go to the dentist just like the rest of us. It'll be fun. I'll hold you in my lap, and the dentist will
just check to make sure your teeth are cavity-free, so you'll have a beautiful smile.
Why would a general dentist refer patients to us?
Well, obviously, a general dentist would refer a patient to us if the patient was a kid, because kids, especially younger ones, need to be treated very differently than adults do.
Duh! Their mouths are a lot smaller and require smaller tools, and they can be pretty squeamish when the dentist works in their mouth.
Pediatric dentists also take care of patients with special needs, as they also need to be handled a little differently and with more care than adults.
Now, let's talk money.
On average, pediatric dentists make $174,825 per year, but their salary can range from $102,087 to $268,156 a year.
Pediatric dentists usually work with dental assistants and dental hygienists. They can also be on call and respond to emergencies in the regular dental office or even in the hospital.
Thanks for watching!